Okay, we will go ahead and get started. Welcome, everybody. I am Chuck Carney, Indiana University Director of Media Relations, here with leaders from the city of Bloomington, Monroe County, IU Health, and Indiana University to talk about issues related to the COVID-19 efforts. With us today, as always, Bloomington Mayor John Hamilton, Monroe County Commissioner Julie Thomas, IU Health South Central Regional President Brian Shockney, Monroe County Health Department Administrator Penny Caudle, Monroe County Emergency Management Director Allison Moore, and IU Assistant Vice President for Strategic Partnerships, Kirk White. As always, we'll take media questions in the chat after opening comments, and we will start today with Mayor Hamilton.
Thank you very much. I hope you can all hear me. Appreciate the chance to be together again. I think I want to start today just by noting that in some ways a resurgence is underway in our community. At least there's a significant risk of that happening. I can report we've had 2 more employees diagnosed. That makes 7 in the last 4 weeks. And that was after a 12-week period of no cases. I know several local restaurants have closed due to employee sicknesses. We've seen the Indianapolis experience, which just yesterday announced some significant changes, closing bars after new cases there doubled in the last week, and closing all restaurants from midnight to 5 a.m. and some other things. Of course, we saw the governor's mask order, which will go into effect Monday, I believe, statewide. And locally, I know we'll hear some more data about some of the data showing challenges here. And this is all before the return of 30 to 35,000 students in the coming weeks. So we did put a new city order in place in effect noon yesterday. I know and appreciate again the county health order that went into effect on the 17th last Friday for masks and orders for bars and restaurant table-only seating we've put into place now in the city, and that will come into effect, I know, in the county in a week. Social gathering limits as well. I will share a number that I want to give to you, and I'll put it in the chat room, or if someone else wants to is fine. We have a number to call in concerns, reports, if you see particularly establishments that where you feel they're not following the directions, the order. That's 812-349-3501, 349-3501, and thank you for those reports. We've actually done a number of visits just last evening to bars, and I think the compliance was good from a number of city employees as we went through, but we have to be extremely vigilant and improve education. We are working now to make sure that every returning student, I know they will get much information from IU, and we're working with the apartment association to make sure they get direct information as they return to off-campus apartments. I want to just note as well, a lack of testing, it's really important to name this problem. There's some debates about this, but in Indiana, we have seen it's a major impact in our community. Some of you know, I'm sure, people who have not been able to get testing. But a major change came because Indiana University, which wanted to require tests before every student came back to campus, essentially was flummoxed and could not do so because of the lack of testing availability in Indiana and also around the country. The lack of the availability of that testing meant they could not test and require tests from all the students to be done within a 10-day period before their arrival. Indiana University is going to do, I know they're working very, very hard to do all that they can. They're going to test all the students as they arrive, which is helpful. But I think the bottom line of that is we can probably expect several hundred people with infections to be coming to our community in the next several weeks, which is going to put more pressure on our local epidemiology, if you will. So as well as, of course, having K-12 schools, many of them looking at opening in the next several weeks. So this is a very challenging mix of developments. It reminds us how important the compliance with the orders of masks, as well as physical distancing, as well as the social gathering limits are going to be critical. How we all perform and behave in the next few weeks, I know we've said this, but it's going to drive the behavior and the performance of our community, what we're able to keep doing. Some communities in Indiana and many around the country have had to move backwards in significant ways. And I think we shouldn't discount the challenge of that here. We are seeing signs of that already. And it's just a constant reminder that really each of us taking the responsibility to follow these rules and protect ourselves and our community are so important. So I'll be happy to take questions as we go further. And thanks again for all the work that so many people are doing, collaborating to try to get us through this continuing health challenge.
Okay, thank you, Mayor Hamilton. Go to Monroe County Commissioner Julie Thomas.
Hello, everyone. Thank you so much for being here. We appreciate being able to have these weekly press conferences, and I think they're really helpful for the community. So thanks to everyone for participating. Just a couple of quick notes, and you're going to hear more details from Penny Caudle from the Health Department and Allison Moore from Emergency Management, so I don't want to step on their toes. But just a reminder that county buildings are open by appointment only, so please call or email the department you wish to visit. Everyone is required to wear a face covering inside county buildings. Of course, our employees are as well, but we will provide them for you if you need them. Also, a note that we are really proud to be working with Downtown Bloomington, Inc. and the Greater Bloomington Chamber of Commerce. They're also handing these decals out for any business, any social service agency, anybody that has a public door that wishes to post this can pick up a free window plane. They're smaller than this. This is just my sample. And those are available at the county courthouse as well. So you can go to Downtown Bloomington, Inc., Greater Bloomington Chamber of Commerce, and or the county courthouse. We're also, in addition to handing out these decals for free, we're also providing face coverings, masks, and shields for residents who need them. Allison will give you a full list of opportunities to pick those up and locations. But at the north door of the courthouse downtown, between 9 and 4, Tuesday, Wednesday, and Thursday, you can pick up the window cling, and you may also pick up face coverings if you need them. So we're doing everything we can to make sure that we are following this health order. Just a reminder that a few weeks back, the council and the Board of Commissioners worked together to create a township assistance fund for people having difficulty paying necessary costs like rent and utilities. We're really proud to be able to do this. We're working with all of the township trustees to make this happen, and every resident of Monroe County has a township trustee. So if you're struggling, we know the moratorium is ending on payments with things like utilities and rents, and unemployment is changing this week. So if you are concerned about making ends meet and keeping a roof over your head, please contact your township trustee. They have a lot of information for you and a lot of opportunities to get help. We do want to note as well that we will have, we are going to be providing CARES funding that came from the federal government to the state to the county, that we, beginning on Monday, will provide some CARES funding for local businesses and social service agencies who have had outstanding expenses that have not been covered by other means, such as a loan, a grant, or other programs. And we will have that form on our website to submit receipts beginning on Monday, the 27th. Also, with our health order, we will have an online reporting form and a hotline number available on the 31st on our county's website. And again, co.monroe.in.us. And in preparation for the health order, that was passed. The Monroe County Board of Commissioners passed Ordinance 2020-33 on Wednesday at our meeting, whereby we ask the sheriff to enforce the mask ordinance. We are, of course, focusing on education and information first, providing face coverings to anyone in the community who needs them. We're asking our officers to do that, and Ms. Moore has been instrumental in getting that material out to our law enforcement agencies. But this is something that we believe is so important that we have asked the Sheriff's Department to go ahead and enforce that. We do want to, again, thank everyone who does continually follow the advice of science and wears their face covering everywhere where they are in public, when they're outside their home. This is a great sign of love for your community, respect for your the residents, the community that we love, and it will help us keep our economy going. We don't want to have to go backwards. With that, we'll take any questions as well. Thank you so much.
Okay, let's go to Penny Caudle.
Oh, good afternoon. My button wasn't working very well there. So thank you again. Thanks for everybody for joining us today. Just to kind of go over last Friday, we talked about the health order that was issued by Dr. Sharp, our health officer. And then on Tuesday, our Board of Health took that health order and did a regulation. So what that really did was put some extra enforcement capabilities to that health order. It allows us to use our Ordinance Violation Bureau. It gave authority to all local and state police to enforce the order. But with that, there were a few minor changes. The other part of that is after we released that on Friday, we got questions. And so we wanted to be able to provide some clarification. So when the board approved the regulation and it mirrors the health order, they are essentially the same with the regulation adding the enforcement piece. But we provided a little bit of clarity. So we did release after that a revised health order that matches that regulation. Those are up on our website. But I will say we were going to send them out with a press release, kind of giving some explanation about all of that. And the governor released his statewide order for wearing face coverings. And we wanted to kind of hold off and try to look at that so we could also include clarification on things that might be in the state's order that differ from our local order. Fortunately, that's not up yet. So we will go ahead and we will make that release just to provide a little bit of clarity. And I would say, just in general, remind everyone that if there is a discrepancy, if there's a difference between the state order and the local order, whichever is the most restrictive is what needs to be followed. So we can be more strict than the state. We cannot be less strict. So whichever is the most restrictive will apply. Some of the things in the regulation, some of the things that we clarified in the health order have to do with people completely covering. So, we talked a little bit about people using crocheted face masks or something like that. So we did add a completely covering that completely covers the nose and mouth surrounding the area of the lower face. So that is to just clarify that crocheted face covering does not meet the guidelines and the requirements. We also addressed kind of workspace and being able to physically distance in a workspace or have some barriers to provide that separation and safety for coworkers, but that if people were up and moving around, that they would still need to don their face covering. We addressed a little bit about childcare and pre-K, preschool, and again, we want them to follow CDC guidelines. That is an area where the governor's order was a little more specific, I believe, but we won't know exactly until that order is released. We talked a little bit about just personal businesses, personal services, and match that very much with the state orders that if you will need to wear a face covering unless it interferes with a particular.
Oh, Penny, you muted yourself there. Oh, still muted.
Okay,
There you go.
are we good now?
Gotcha.
All right. It's a rough Friday. So
I did it, sorry.
if you were in a salon and you were having a facial or something, obviously you're going to have to take off your mask during that facial, but your provider, the person giving you that facial, would need to maintain that face covering. So we just really tried to provide some of those things in terms of clarity. In terms of the violations and the ability to write fines, that is not our primary intent. Our intent is for people to simply comply and do the best they can for their fellow citizens. But the regulation is very clear to note that nothing in the regulation gives individual residents the authority to intimidate or harass individuals who do not voluntarily comply or who are found out of compliance with regulation. Again, I will go back to what I had said one other time, and I didn't come up with this on my own, but we versus me, that if we act in terms of a we mentality, that what can I do to protect the we in our community? And if we each think in those terms, how can I act? I can do that physical distancing. I can wear a face covering when I'm out in public and I need to. I can make sure that I'm washing my hands, I'm cleaning, I'm staying home if I'm sick, I get tested if I need to. If I'm doing all of those things on behalf of the other people in my community and everyone else is doing the same thing, we will all get through this much easier and much faster than if we have an I mentality and or that me mentality, and we focus on us individually and not on the greater good of our community. So I would encourage people to do that. As Commissioner Thomas talked about, next week we will have an online complaint system up and going. We'll also have applications available for the exemption on gathering size. I do want to provide some clarification that those gathering size exceptions may be limited based on community spread and what our circumstances are in their community. So just because that option is available doesn't mean that it is an automatic. We will be looking at what people are doing and ensuring within that event to maintain safety and the protection of all people that might be involved. But we will also look at what's going on in our community in terms of virus spread and activity. The CDC, the couple other things I wanted to note, the CDC has changed some of its guidelines, in particular on release. So we've talked a lot, you've heard us talk about if you're ill and you have to be fever-free for 72 hours without fever-reducing medications, it's been 10 days since your symptoms started and your symptoms need to be improving. And now they have lowered that 72 hours fever-free to 24 hours. So there are a few other guideline changes that have come out as well, and those can be found on the CDC's website for COVID. The Optum site, I know we've talked a lot about that, and that they've had to close some due to the heat. They are getting some air conditioning that's coming, some portable air conditioning. And that was something we had talked about early on. And thank you. I think it was, I don't remember who, Brian, if it was you or Carol, that suggested those portable AC units and helped us get estimates for the state, and they finally approved that. So those will be coming, and that should allow them to be open their full set of hours. But I will also say that their normal schedule is to see 132 people a day. And even closing early, they have seen as many as 300 or more people in a day. So they are doing a tremendous amount of testing, given the barriers that they have faced. So I do want to, testing may be problematic in that everyone can't just get a test who wants it. And it's not, recommended that everyone just get a test for the sake of testing, but to test if you think you've been exposed, if you're symptomatic, if you've, been put at risk or you have a concern or an underlying health condition. And we are seeing with these hotspots that have come up in other states and other places, and as that expands, more of a demand on testing supplies. So it is important that we focus and keep those things in mind when we are seeking out testing. Thank you.
Okay, let's go to Monroe County Emergency Management Director, Allison Moore.
Thank you and good afternoon. I'd like to start by letting individuals know that we have an alert system in Monroe County. We've mentioned it a couple times, but it's been a couple weeks. And so just like to reiterate, we have a mass notification system. You can register on our county website at co.monroe.in.us. And there is a big button that says Monroe County Alert. You click on that button and you can put in your information. Not only do we send weather alert information out, but we also send our health orders out as those become available. So I encourage Monroe County residents to sign up for that mass notification system. We have a new scheduled blood drive. The Monroe County Convention Center has graciously worked with the Red Cross yet again, and that date is scheduled for August 24th. It will be again by appointment only, so you go to redcross.org and can select a time, and it is not, they only put 24-day window out. So when you go, if you're looking for that today, it's going to be hard for you to find. You have to go to the calendar, select the day you want, and change that that time frame out to select a spot. And I think within just a few days, the 28th spot that we currently have that filled quickly, just a few days. So if that's something you're interested in, I encourage you to go and do that quickly, because I assume that our August 24th date will again fill up very quickly. Lastly, I'd like to just quickly mention again all of the sites that we have available that people have graciously been willing to have face coverings, face shields, and face masks available for our Monroe County residents. We do have a list on our county website that has all of our phone numbers for these locations and the address available for you. Other than the Monday, Wednesday, and Thursday courthouse pickup, we are encouraging you to call one of the numbers from the list on our website between the hours of 9 to 3 and make an appointment to pick up these face coverings. And the list is, the county offices are Monroe County Commissioners, the Board of Commissioners office, the Monroe County Health Department, and the Monroe County Emergency Management Office. And then our fire stations that are willing to hand these out for us is Bean Blossom Station 6, Benton Station 14, Bloomington Fire Department's Stations 1, 2, 3, 4, and 5, Northern Monroe Fire Station 25, Ellettsville Fire Department Station 71, Monroe Fire Protection Station 22, and Van Buren Fire Station, Station 29. We also have trustees' offices that are willing to hand these out, and we've actually added a few from our original list that are now willing to hand these out, and we're very gracious of that. And those are Bean Blossom, Benton, Clear Creek, Perry, Richland, Salt Creek, Van Buren, and Indian Creek. And you can contact, like I said, any of those during the hours of 9 to 3, or pick them up at the open hours at the courthouse to make those appointments and or pick those up. That's all I have, Chuck. Thank you so much.
Okay, next to Brian Shockney from IU Health.
Thank you, Chuck. I just want to begin by saying thank you to all of those who are faithful followers of our Facebook every Friday, and the media who joins us. We have been taking stock of the past 6 months here at IU Health, given what we're experiencing this past weekend, specifically in the last couple days, which I'll share with you in just a moment. But we are moving from educating on the whys of masks and the things that we need to do. We think we've shared that a lot. It's really about behavior. And so we as an organization and as a community really need to be talking about our behavior and how we act when we're in the grocery store with our masks and how we so physically distance. We can continue to share the message, but we're finding that when we start challenging one another here about if the mask goes a little below the nose, hey, you've got your mask, good job, but could you pull that up above your nose and wear it the correct way? And so we're finding that we're into that next level. We've heard the messages over and over. It's time to be challenging each other and having the conversations about our behavior. So with that, we've spoken about our Safe Care Pledge here at IU Health, and that's designed to promote safe practices and help our patients and visitors and team members. And the first step in the plan is, of course, requiring everyone in our facilities to wear masks. And we're very pleased with what the governor has done in this statewide mask mandate. It's encouraging because we know that it's helpful. We know that it will help prevent the spread of the virus and actually can stop the spread of the virus. These masks are becoming a normal part of our life. I have some on my desk. I have 3 hanging from my rearview mirror. My wife is washing them continuously. It's just becoming a part of who we are. And I hope that's how you're feeling as well. That it's just becoming a part of what you do when you get up from your chair, or your table, or you get into your car, out of your car. It just becomes muscle memory for you. And if it's not, then we still have to continue to do some work there. I will say the last time I was at a grocery store, I saw that people were wearing their masks, and the majority were, and that was a good thing. And we're very pleased that some of our businesses are requiring that as well prior to the mask mandate, and now with the mask mandate are requiring that as well. So I do want to talk about our numbers. We have seen a surge, and someone I saw in the comments had said the numbers had gone down from a hospitalization. They have not. I think it's a timing thing from what you're seeing. But we have seen, as you can see here, since the June 25th date, a continuous increase in the number of COVID admissions across here in Bloomington and Monroe Hospital. And so we, in the last couple days, have seen an alarming trend. And I just want to remind you that this trend includes those who are admitted and the turn of those discharges as well. And so this is our census, our daily census, not total numbers. So we are concerned about what we're seeing. We are, again, on incident command as we have been, but we stepped up our incident command in the last 24 hours to be daily to ensure that we are monitoring this and focused on what's going on. I know in the county, if you look at our numbers on the county website, we have seen one of the highest increases in positive counts. Of course, our testing is up, we realize that, but in addition, we're continuing to see, as on your screen now, this trend in numbers of positives per week. And so this is just the positives. When we look at the number of patients in the last 48 hours that we have in our inpatient beds that have symptoms, we call them symptomatic, who are waiting test results, this number could quickly double in number. So it is very important for us to be sure that we are following all the protocol in our community that is required in masking and being sure that we are practicing our physical distancing going forward. There was also a question around ventilators, and while the state website is checking on, always putting in the numbers, every day we put in our numbers of those patients who are on ventilators. Over this past several months, we've learned, as we've treated patients, that ventilators are a good way as a last resort for ventilation and oxygenation of patients. High flow oxygen has become the new way and the best way to treat patients. So while we do have a great supply of ventilators, most of our COVID patients are treated now on high flow oxygen, what we call OptiFlow. And so the ventilator counts that you're seeing will not be an indication of those patients who are needing that high level of oxygen in their bodies because of the effects of the COVID virus. So I just wanted to make that knowledge known that while in the beginning of this pandemic, putting people on ventilators was the initial treatment, that we learn every day. And as we've learned across the nation, that high flow oxygen is a better way to treat these patients, and pronation of these patients. It's the physical positioning of the patients with this high flow oxygen versus ventilating patients on ventilators. So that's why those numbers are less important than they were in the beginning of this pandemic. Again, testing is an issue across our nation, across our state. It is the supply of testing that is the problem, and we just haven't been able to produce the supply of testing kits and instrumentation quick enough to keep up with the demand. And as Penny Cottle said, we want to be sure that those who are getting tested are appropriately getting tested, and we're not utilizing those test kits and machines for asymptomatic and people who have not been exposed to the coronavirus in any way. So we would like to encourage people to continue to wear your mask, practice good hygiene, and continue to keep our community alerted and awake to the need to protect themselves and others from being infected. So wearing those masks, wearing gloves, personal hygiene, physically distancing, all those things are very important, still remain important. But again, I'll end as I began. We need to call each other out on our behavior. Whether we have the mask, whether we're physically distancing, are we doing it properly? Are we doing it well? And are we doing it all the time? And with that, I'll conclude my comments.
Thanks, Brian. Before we move away to you and to Kirk, there was a question from Emily Ernsberger about the second graph, asking if those are people who are in the hospital for other reasons who also tested positive for COVID-19. She wanted to clarify that.
That is, no, that is not the case. These are patients who presented to us with symptomatic COVID symptoms and were tested and were positive.
Okay. All right. With that, let's move to Kirk White at IU.
Hey, good afternoon, everybody. First, from the university's perspective, we again want to thank the city and county administration, particularly the mayor and his administration, for the great cooperation on many fronts, but in this case, certainly with the new orders, we believe that this is a great step forward in helping protect the public health of our community, and we're pleased that that occurred. And with the county order as well, how various constituents at Indiana University, including fraternities and sororities, were specifically mentioned to make sure that responsible behavior is expected from them as well. As I've mentioned before, we believe very strongly and will enforce the masking and face covering policy on the campus. We also expect that the students will, and our faculty and staff will get into that habit off campus as well. And along those lines, we are distributing cloth face masks to 2 of them each to all of our faculty, staff, and students. This is quite an undertaking, as you might imagine. They're scattered all over the place, but we're mailing many. Some will be distributed as the students arrive at various distribution points. And then as a sustainment effort, we'll be distributing disposable masks all over the campus. So there will be no shortage. They'll be distributed through academic departments and other places in case someone might forget their mask, including our building management offices and things to that effect. Along the lines of testing, we obviously expect that all of our students would get tested before they come to campus. We discussed that and issued those guidelines back a couple of weeks ago. The problem, of course, as the mayor outlined, is that there are insufficient testing capacities around many parts of the country, including parts of Indiana. This becomes an issue. So what we have done is we're doing quite challenging work to figure out the logistics to test all of our students as they come to campus. And this will give us a way to, as quickly as possible, determine if they've been exposed or if they're positive for the antigen. And this will help promote the overall safety of the community, but keep us in a much better position in the campus health as well. So we know this is an issue. So this is a problem that is going to take a lot of logistics, but we've secured, we believe, a lot of the supplies that we'll need to do this. There's still details being worked out, and people are working night and day to get that done. So I'll be able to report more on that. Finally, I think there's discussion about what to do about quarantine and isolation with the campus population. For those living in our residence hall system, we've, which is, around 10,000 students, we have a quarantine and isolation facility that will be staffed on the campus. For those that are living in private apartments and homes, we would expect them to either quarantine or isolate themselves just as they would if they were at home, using their own bedrooms and quarantining and isolating themselves from their roommates if they have them, just as you would if you were home, and being responsible that way as well. So that's our update today. Lots of work to do, but a lot of people working to make sure that we can be as successful as we can. Thank you.
Okay, thank you, Kirk. And we will start questions. And I know that there are a ton of questions we're getting from Facebook. We are going to try to get to some of those if we can, but we have some from media we're going to need to hit first here. This one from Ernest Rollins, the HT, for the mayor and Penny. Can you elaborate on what happens after I call or report a violation? Who goes out to investigate? And would that person have the power to fine an individual, groups, or shut down a business? Can complaints be appealed?
I can start if it's okay, Penny, and then hand it off to you probably. So thank you. The city has particular responsibility during this 8-day period before some of the county order goes into effect. And apologize about the noise. Can you hear me okay? Sorry, there's a little work going on. And actually the response depends a lot on the details. So call the number that I mentioned, 812-349-3501. We have city employees in various departments who will respond depending upon which kind of report it is. If it's an institution, sorry, there's serious work going on here. If it's like a restaurant or bar, we may send one set of people. If it's a social gathering, we may send another. We know great experience working with IUP, Indiana University Police Department, and the Bloomington Police Department responding to social gatherings. I do think we want to be cautious and note that individuals walking in public down the street or on a sidewalk or in a park without a mask are, of course, can do that if they're staying 6 feet away. And we're not really asking law enforcement to approach individuals specifically if they don't have a mask. That's not the kind of engagement we're looking for lots of reasons. But again, call that number. We can send different city employees from Community Family Resources, Housing and Neighborhood Development, Fire Department, Police Department, others that can respond depending upon which kind of institution it is. And And I will note that we don't have fines set up in the city. I know the county has done that, which is great, which will of course cover the whole county, including the city. But we will shut down an establishment or an activity if it's in severe violation of what's done. Probably through an emergency court order, we would do that. Thanks.
Yeah, just to kind of tap onto that, similar process. Right now, we're using a similar process we would use ordinarily for simple complaints is what I'm going to say, something that depending on what it is, right? If right now we're seeing a lot of face coverings, for examples, in workspaces, because that's been in place for several weeks now that certain businesses, employees have to wear face coverings. So we've been dealing with those. But if someone calls, again, we're hiring some people to handle these specifically, and kind of we'll be tweaking our process a little bit. But the first thing really will be to confirm that it is a violation. Sometimes we get calls and people have a complaint, but in reality, the complaint is not a true violation. So we'll have to sort out whether or not it's actual or not. We call to kind of follow up on that to see what they're doing. If it's a business and they've submitted their plans, we may look at their plans to see what they've got in there. And it is situational. What's the complaint? What's the extent of it? Is this the first complaint we've received? Because again, we want compliance. So we know that it can take businesses and individuals time to really learn that there are requirements out there that they were not aware of. And so we always start from a did you know standpoint. We want to educate and inform people, make sure that they understand what the rule is around whatever the complaint was. So if it's about a business, their employees not wearing face coverings, then we're going to call. We're going to look at what their procedures are, what they're doing, make sure that they understand that. Our system will ask people, honestly, to provide some sort of documentation. How can they document this violation if they can do that? We understand that won't always be the case or something that people can do, but that will help us know what we're looking at, and it helps the business. And we've had that happen before. If we can confirm that, they know that it did happen and it wasn't somebody just saying that they didn't do it. We may go out and send staff out to look and see what's going on. We've got discussions about just sort of sending teams out to kind of do some general checks and random checks, those kinds of things. So we'll follow up. Again, we don't want to issue any fines. That is more of a last resort, if you will. If we get to that point, we will certainly do that. The possibility of closing a business is there. Again, I think that would be a highly unlikely situation. I think that good negotiation skills and good information and education can go a long way. And that's really our goal and our intent, is to make sure people understand what the guidelines are. And I will tell you that we've had many businesses call us. They want to comply, and the questions that we talked about earlier that we wanted to kind of provide some clarification, they really were from people wanting to be in compliance, and they just wanted to know what the rule was and were they understanding it correctly and those kinds of things. So that's really it. It's about contacting people, making sure that they understand what the rules are, and following up and going forward as we need to.
Question from Ethan Burks at WFIU, WTIU, Fort Penny. With the rising number of cases and school starting right around the corner, how will your department be coordinating with CSC? Have there been any discussions of pushing back the school start date, and how would a decision like that be made?
Certainly. So we've been working with the schools since spring, winter, I guess, really, I should say, but since back in, February, March, we've been working with the schools all along, individually and collectively. The schools have the final determination about when they restart, how they do their reentry, but we have been participating in those plans and communicate with them regularly. With the increase in recent cases and the potential to impact our hospital, we have contacted schools to let them know that this may be a time for them to consider their plan B or consider postponing a little bit. You know, maybe it's a week, maybe it's 2 weeks, to see if this is an odd uptick and things come back down, or if it's going to be more sustained. And each of the schools have different start dates. They have a little bit different plans in terms of what that plan B is, but they all have plans for options so that parents can make decisions that they feel comfortable with. And that's certainly part of that decision-making triad, or I guess it isn't a triad, but that decision-making system that each school will have. There are options for parents, and parents can choose what they're comfortable with. But each school system will have to look at their plans, what's going on, what they're hearing is going on within their school, where their comfort level is. But certainly we are concerned with the last few days and the stark increase in cases. We're looking at those, making sure that they're not old cases that have been recently reported, making sure that they're not double counted or something odd like that. We want to rule those kinds of things out. But certainly when we know that people are going to our hospital, we know that that's indicative that those are new cases. And we know that we have community spread, which is all the more reason that we have to assume that we could be infected. That's why we wear our face covering, and that we provide that distance, and that we follow the guidelines so that we don't inadvertently spread infection to somebody else.
Okay, also from Ethan, for Mayor Hamilton, are there any other preventative measures the city could take to keep everyone safe as thousands of students return in the coming weeks? Restrictions on bars have already been made. Is it possible to shut those down as they have in Indianapolis?
Short answer is yes. We really need to monitor this, and we could take those kinds of steps. Indianapolis has shut down bars. They've closed restaurants from midnight to 5 a.m. They've backstepped a little bit in terms of numbers, and we should be looking at that. We will be looking at that, both countywide, which is, of course, the easiest way to do it, or if we have to do it in the city. And we'll continue to work with our health experts to give us advice. These are really serious weeks ahead of us. So all those options are on the table, absolutely.
Question from Emily Ernsberger from the Herald Times wanted to ask what the ages are of those hospitalized locally. This one going to Brian. We are seeing significant increases in young adults, 20 to 29, testing positively. What ages are being hospitalized?
So thank you for the question. The ages of the patients who are being hospitalized has not changed dramatically since the beginning of this pandemic. We know that the younger patients who get this virus can be cared for isolating at home and being home because their bodies can manage it. However, we have seen some younger patients who have succumbed to this virus over these past 6 months. So no one is immune, but our percentage of patients requiring hospitalization, the percentage of breakdown in the ages has not changed dramatically.
Okay, and to everybody here, we've got quite a few media questions which happen to correspond to a lot of the questions we're getting on Facebook. So if you can hang on, try to work through some of these here for a few more minutes. This one for Julie Thomas from the B Square Beacon and Dave Askins. Could you give a couple of specific examples of the kind of expenses that a business could get reimbursement for under CARES Act funding?
Sure, thanks for the great question, Dave. Yes, so we're imagining if there's an office that had to purchase plexiglass, for example, to keep employees safe during customer interactions. There could be gloves, masks, other PPE. So those are the kinds of expenses not anticipated, not covered elsewhere. So what we're trying to do is make sure that our local business community and our social service agencies are not out of pocket due to the COVID-19 pandemic.
Okay. And Dave, by the way, your question, I think earlier Brian answered, so that's why I haven't delivered that one again. But let me know if that's not the case. This one directed at me and Kirk White from Dave. So Indiana University and Bloomington Transit are delaying the usual contract negotiations for the contracted bus service until September so that both sides have a better idea of how much transportation service the university will be using in the coming year. That will depend in part on how many students arrive back in Bloomington and where those students who do arrive will be living. Does the university have a clear idea of how many students total will be living in Bloomington and how many will be living in residence halls? Kirk, you indicated about 10,000 in residence halls.
Well, that number is a little high because that includes some of our apartments. So for broad planning purposes, I think the residence halls are going to be down around the 7,000. The undergraduate residence hall is about 7,000 because what we've done is we've changed the whole configuration where you'd have double rooms. They're now singles in most cases because we wanted that ability for separation and de-densifying the campus as much as we could. So the residence hall's census will be lighter this year. Some of those students have decided to go online. Some of them are contracting and signing leases off campus that would have been in the residence halls. We've had a few hundred cancellations from the residence halls contracts. We've given students the opportunity to do that. We've extended the cancellation date out till July the 31st. So students and parents still have to decide whether this is the right decision for them. We want them here. We want to continue operations, but we realize this is a very challenging time for everybody. So there will be a lighter population, but at this point, for example, the freshman class is still holding pretty steady between what we're seeing is 7,800 to 8,000, somewhere in there, like we would have normally expected. So I think there will be less students, but we don't have a handle yet. As people are making decisions, we don't have a solid handle on the number yet.
Kirk, sticking with you here, will it be possible for some residence hall and Greek house students to delay being tested for COVID-19 until after arrival on campus? And if so, which students fall into that category?
Well, we're working that right now. We think it would be, obviously it's best if you can test before you get in the car and drive to Bloomington. That's what we'd like for you to be able to do. And so that's what we're encouraging people to do. If they can't, for whatever reasons, our next step is to get them tested as soon as they arrive here and plan to stay. We have some people that will move into the dorms and then leave for a few days and come back. Well, that gives you a few days in there of extra exposure time away from the campus. So it's best if and that's the kind of strategy we're putting in place. We're right now working through rather large mobile testing site capacity at locations on the campus and how we staff up to do that and exactly what type of tests we'll be using to do it. And that goes back to supply, but we're feeling pretty good about the amount of testing supplies we're going to be able to get to pull this off.
Yeah, Mayor Hamilton.
Doug, I just wanted to, first let me say I'm glad logistics is, Kirk White, somebody who's dealt with logistics all around the world and, lots of complicated places. Thanks for working on that. But look, IU is facing serious problems trying to make up for testing capacity themselves when it's not there kind of in the wider world, and appreciate them trying to do that. The specific question about Bloomington Transit, I just want to note, Bloomington Transit being under the city, we do continue to negotiate. There's so much uncertainty now. Students typically make up 70% or so of the ridership of BT, but what the behavior will be in the next few months is really uncertain. How many will be going to campus with the buses and how many won't. So that negotiation is understandably kind of ongoing to try to figure out what that will be like. And Bloomington Transit is working really hard to try to make everything safe and work for all of our people who depend upon that to get around. Thanks.
And I guess the amplifying point on that is that at our public transportation systems, we're trying to de-densify them as well. So the capacity of the buses will be smaller because of that.
Kirk, sticking with IU again here from Dave Askins again. After instruction starts, surely there will be scenarios where a large number of tests need to be completed with a short turnaround time for results. And he's asking, does IU Student Health have the capacity to get those tests done? How will those students get tested? That speaks to what you're talking about with us trying to develop capacity.
That's right. And we are developing that capacity through our partnership with the IU School of Medicine. We have a team of 4 or 5 of our best epidemiologist doctors that are leading a team that's working on what we're calling on-site and surveillance testing. So this will be a continual testing process as the semester progresses. The health center obviously will be there for our students who are symptomatic, but all students will have access to the IU Health app, which any of our students, faculty, and staff can use. They go onto the app, they check their symptoms through the app, and if they need to get tested, they're then directed how to get that done. But we'll also have this response type units that will be able to solve particular problems like this. And I'd say that we're also asking our faculty to maintain pretty strict seating charts so that we can track who's in a classroom at what time. Again, I'll just say that the capacity of our classrooms has been reduced pretty much by 2/3. So a normal classroom with 100 seats will be reduced to about 30 so that we can keep the distancing in place.
Quickly, a few more questions here from B Square Beacon again. It seems like the missing ingredient for testing is reagent. Do we have any plans locally to bootstrap our own testing operation by purchasing reagent on the private market? Penny, I don't know if that's you or who wants to take that.
Well, there are probably parts of that I can't address, but we are looking at other possibilities for testing. There's a small amount of state funding that could help us. So we are looking if we can find a site and some additional partners in the community, then we might be able to pair some small state funding with some CARES money and other sort of donations, if you will, to put that testing site together. That doesn't answer the reagent part. I don't have an answer to that. But Dave, the other thing that I was going to say, though, in terms of your question about testing people in a class, and Kurt kind of alluded to this, but if you have a classroom of 30 people, even, not necessarily everyone in that classroom is going to need to be tested, only the close contacts, and they wouldn't necessarily be tested immediately. They would be advised to go into quarantine and test when they became symptomatic or sometime after 5 days. But even testing negative would not shorten their quarantine period. What testing would do is if they're positive, then they become a case and we contact trace from them out.
Okay. So also for Penny, what kind of turnaround is OptumServe giving us nowadays for results?
Well, I think like many places, they did have a period of time where they had a longer period. They're using private labs, but the last I heard it is still in that, I think 48 hours, maybe 72.
Okay. And I think we've addressed most of this. This is a question from Ernest Rollins. for anyone. What are we doing to increase our ability to contact trace as K-12 schools reopen and IU students are returning? Are we planning to continue to rely on state help with this or have more local teams? So Kirk, I know we're building that up at IU for sure.
Yeah, we sure are. We're dedicating a rather large group of employees. In fact, we advertised for those positions, and I think we've pretty well filled them all. We'll have a whole team of contact tracers the university will employ to do the tracing for the campus community, and we will match that all up with the local and state efforts as well. So it's all going to communicate together, but we're going to do our best because it's in our best interest to make sure that we pay for this, we get it done, and trace what's going on in the campus community.
And Penny, you want to add to that?
Sure. As far as the K through 12, certainly the schools will be important partners as well. Just we talked earlier, someone mentioned the seating charts, those kinds of things, so that the process of a parent, for example, notifying the school that their child's positive, they'll contact us and we will immediately be able to start assessing who those close contacts are and then feed the state into the system for follow-up and kind of further out contact tracing. We have had some discussions about whether or not we might need to add an additional nurse time for that.
Yeah. Mayor Hamilton, do you want to add to that?
Just very briefly, I want to be clear, individuals and individual institutions are doing yeoman's work and they're stepping up and they're doing fantastic work. But this is just infuriating to see. It is a lack of investment and focus on national public health infrastructure. To have us struggling like this time without the testing capacity, without the contact tracing capacity, with all these amazing people trying to assemble this, but it really is frustrating, and I don't want to go without commenting that it shows a lack of investment in the public health infrastructure and the response to this crisis at a national coordinating level. So all of us are struggling to try to respond, as we all are, as best we can. But it is, I just want to note that for the record, it's pretty frustrating.
Okay. We're going to end it there. I appreciate everybody hanging on for an extra 15 minutes here and appreciate the interest on Facebook. We will be back next week. There will certainly be more to talk about, and we'll be back next Friday again at 1:15. Thanks, everybody.
Thanks, Chuck.
Thank you.
Appreciate you.
Well.